Breaking news this noon, a doctor and a pilot are being treated for injuries after a small plane associated with UNC Health crashed at RDU International Airport. Good afternoon to you. I'm Jeff Hogan.
And I'm Renee Chu. Thanks for joining us. We've been following this story since it broke shortly after 10 o'clock this morning. We have team coverage for you with crews on the ground at the airport and Sky 5 up in the air.
First now, here is the indication of a problem that was happening. Take a listen.
Ops 1, Airport 3. Go ahead, Ops 1. Head to gate 15. We do have an aircraft down with damage.
That's on the runway there near Terminal 1. WRAL's Sean Gallagher is talking with passengers about the impact this has had on their travels. But we begin with Monica Casey with what she's learned about the crash. Monica.
Yeah, Renee, we have moved here to the top of the premier parking garage at RDU. Police told us they would be shutting down the area where we were because of the ongoing investigation. Now, I want to show you just how close all of this is to Terminal 1. That's over here on the left. And if you come across, you can see where the crash happened. It's much closer to Terminal 1 than Terminal 2. You can see the remnants of the plane over there. We are still seeing a police presence on the runway, but far fewer fire trucks and EMS personnel. We also spoke with an RDU employee about what this morning was like for him here.
We had a flight coming in around 10:15. It was delayed, and then, like I said, come to find out, they're not letting anything in or out, and that was the reason, because of the plane incident.
And you mentioned you've worked here for some months. Have you ever seen anything like this?
Never, ever. Never, ever. And I was asking some people around here, had they seen anything like it? They've never seen anything like it either.
Now, RDU confirms the runway over here by Terminal 2 has reopened. We have seen a couple of planes land and take off in about the last 10 minutes. Over at the runway near Terminal 1, where the crash scene was, that is still closed right now from what we are seeing here. Renee?
Good to see things are finally taking off once again at RDU Airport after it was very eerily quiet for the last hour and a half.
Some of the details with this: in just the last 45 minutes or so, we received a statement from UNC Health about the crash, and it reads, UNC Health has learned one of its UNC Air Operations medical planes crashed this morning at RDU. The plane was carrying one physician and the pilot. Both have been taken to the hospital. We are working to gather more information.
WRAL's Ken Smith will take a deeper look at the way UNC Health uses these planes coming up in just a few minutes. First, we want to get out to Michelle McConaughey in the WRAL Live Center with a look at the impact that we're still seeing on air travel at RDU. Michelle.
Yeah, I've been monitoring these cancellations and delays all morning long. Of course, we started out before 11 o'clock this morning on air saying there were 6 delays. Look now, there are 65 delays, no cancellations at RDU. The airspace has opened. Monica Casey was just saying how they're seeing planes take off near Terminal 2. But of course, that secondary runway where that plane went down, that is still shut down. So we still are seeing 65 delays at RDU. Delta Airlines, American Airlines seeing the bulk of those delays. So if you do have a flight, just best to check before you head out the door. The airspace is open. Again, planes are flying, but still, this is going to take a little bit to get back on track because we still are dealing with some breaking news. That plane's still down on that secondary runway.
And this all happened near Terminal 1, closer to Terminal 1 than Terminal 2. But our Sean Gallagher is inside RDU Terminal 2 right now. A lot of those folks affected by these flight delays. I know you talked to some of them, Sean.
Yeah, and a lot of those people who are coming through here were just learning about those delays as they were coming through the door. And you can see, even though flights are taking off, this board here behind me shows the impact of these delays. There are a number of flashing yellow times up there. It looks like roughly, my rough math, it's about an hour and a half delay on average for a lot of these flights. And, you know, a lot of stories coming through here. I saw the NC State's track and field team headed to Philadelphia for the Penn Relays, a giant track and field event held in Philadelphia, that flight likely delayed, and then just a number of people who have connecting flights that are on their way out of here. It's been a busy airport in here. About 14.5 million passengers come through this airport annually, so it is a very, very busy airport. But take a look at this video from WRAL anchor Ashley Rowe's dad from inside the terminal. We can't get in there because of TSA rules, but look, a lot of people waiting around for news about when their flight will take off, if their flight will take off, and now we do know there will be flights coming out of here. But, you know, the people that I talked to, they were disappointed to hear about the delays, but when I told them this was the result of a plane crash, their mood changed entirely, really put a lot of things in perspective for them.
She just texted and said there was a plane crash at RDU, and I was like, oh my God, that's horrible. And then I was like, I didn't even think about it affecting my flight, and I was scared that people were like hurt, and it was a huge thing. But now I'm more scared about my flight.
And Madeline there was headed out of the country to go to a wedding in Peru. She was expecting this to be a very fun day with her family, but definitely going to be a moment where she sees them, probably going to hug them a little bit more. Now, this is a very busy airport, like we've been saying. We saw that the Premier parking lot is full, so that gives you an idea of how many people are probably impacted by this crash here today, guys.
Hopefully Madison got some relief, because not long after that interview is when the ground stop was lifted. So Sean Gallagher, thanks for your work on the ground there inside RDU.
And a lot of folks thinking about those two people on the plane and how they're doing. We do know the plane that went down belonged to UNC Health. It was a medical services plane.
WRAL's Ken Smith is live in the newsroom right now with what we know about the plane and that crew.
Yeah, Jeff and Renee, this plane was a single-engine Staccato plane and seats about 6 people. Now, the tail number is registered to Medical Air Inc., according to the FAA. We know that that company is now part of UNC's air operations. That's a health transport service that takes medical residents, university faculty, and other professionals to different locations around the state. Now, this plane that crashed today at RDU International is one of 6 in that fleet. And according to the website, they typically fly 5 to 7 flights every day, usually between 1 to 3 people on board. An average day for one of these aircraft could be flying a UNC Chapel Hill Dental School faculty to a conference in Asheville, or possibly bringing medical residents to Wilmington to see patients at a clinic. We do know this plane took off from ILM Airport in Wilmington this morning at about 9:30 before crashing here at RDU International around 10:15. UNC Health says the pilot and physician on board were taken to the hospital this morning. Of course, we're working to learn their names and their condition and how they're doing. As soon as we get that information, we'll be sure to share that with our audience. Jeff and Renee.
Thanks, Ken.
All right, let's get out to RDU officials stepping up to the microphone to talk about this crash and the airport's response. Actually, we're first going to the aviation expert and attorney, Jim Krause, who we talked with earlier here on this newscast. And Jim, you were able to look at the debris there on the airfield. And judging from that, what can you tell us about what may have caused the plane crash?
Well, first of all, we don't know, but it looks like a fairly low energy impact, meaning it was not just an aircraft that came forcefully out of the sky. It appears to me that something happened during approach or on touchdown or shortly after touchdown. There's a strong vertical component to the aircraft wreckage, meaning the engine is dislodged, but dislodged downward and forward. The wings appear to have been damaged vertically, as does the tail section. So you don't see much of a horizontal, meaning a crash that occurred across the ground. It occurred fairly vertically. Either it bounced off the runway or it hit there fairly substantially vertically.
Those alerts that go out whenever there is a plane incoming to an airport that has some known damage or has some known problem, those alerts go out pretty wide, and we didn't hear anything about that. So what we can just guess from now is that the initial impact was the first time that they realized that there was going to be some sort of problem. And at that point, not a lot you can do to recover a plane like that.
That's correct. Air traffic control communications will tell us if there was anything that occurred between the aircraft and the ground immediately prior or during the descent. But it looks like this is a end of the flight event, meaning very close to the ground or after touchdown, perhaps a blown tire, perhaps an engine that malfunctioned that created torque that pulled them off the runway, a landing gear collapse, something like that. But again, minimal damage, and it looks like whatever emergency happened, the pilot did a fairly good job responding to it.
And Jim, this is what you called an executive transport plane, not carrying passengers, but in this case, UNC Health using it as a medical services plane. Talk about what we know about flying this particular type of aircraft, well respected in the pilot community, right?
Yeah, I know of no information or hangar talk or rumor that says this is a dangerous aircraft. There are some out there that are a little bit harder to fly, a little bit less forgiving than this aircraft, but it's a turbine-powered, I believe, single-engine aircraft that is fairly expeditious and gets people from one place to another in a good way. So I have no criticism of this aircraft.
Without knowing the pilot or the doctor that was on board, knowing their physical condition, age, things like that, you said this would be, under typical circumstances, an imminently survivable wreck.
From what it looks like, yes. It looks like it is survivable. Again, we don't know the extent of the injuries. That would be based on the condition of the people who are on board and the nature of the impact itself, vertical, horizontal, extended, quick. But this looks survivable at this point.
Jim Krause, aviation expert, thank you for sharing your expertise and your insight as we and investigators try to piece together what happened here to this small plane, a UNC Health medical plane that ran into trouble at RDU there on the airfield. And in about 5 minutes, we are awaiting a live news conference from RDU airport officials. We have crews there. We will bring you that news conference in which we will learn a lot more information here on this newscast. We will take that live as soon as it happens.
We're still trying to get used to some of these live pictures. On the left, that's Sky 5 with a live picture right there. And then from the top of the premier parking deck on the right side of your screen there, quite an unusual sight out at RDU International Airport this morning, affecting dozens of flights, but ground movement is happening right now, and air travel has started. We have seen and heard some flights taking off out of Terminal 2.